Hello, my name is Dwarakanath. I'm a Consultant Gastroenterologist in the Trust, and I'm here to talk about colonic stenting. Why do we do colonic stenting? Colonic stenting is done for one main reason. That's when the bowel is obstructed due to a colonic cancer. This may well have been diagnosed with a CT scan or a previous colonoscopy or flexible sigmoidoscopy. The procedure is performed for two main reasons: when the bowel is obstructed and the patient is not fit enough or well enough to have surgery to decompress the bowel, or it is used as a bridge to surgery when patients get acutely obstructed and do not want to have a colostomy as a temporary measure. Before your procedure, you will be seen by one of our pre-assessment nurses who will explain the procedure to you. You may well have some blood tests to ensure that the test is performed as safely and with the least possible complications. You'll receive a full information pack that will outline the procedure together with any complications that could occur. An endoscope is passed through the back passage to the level of the blockage. We then take X-ray pictures to delineate and demonstrate the position of the tumour. Thereafter, a wire is passed through the tumour and the stent passed across the cancer and released. This then allows the bowel blockage to be relieved immediately. Prior to the test, you'll have had a CT scan that will have given us more information on the exact position of the tumour. What will happen on the day of your procedure? Prior to the procedure, you will have had a detailed appointment letter to tell you where the endoscopy unit is, what time to come to the endoscopy unit. 6 hours prior to the procedure, you'll need to stop eating and drinking. You'll be greeted at the reception by one of our highly skilled endoscopy nurses who will take you into the booking room and ask you some general health questions and check that you're fit enough to have the procedure on that day. You'll be asked to wear a gown and some modesty underwear. Thereafter, you'll be taken into the room. A small cannula, plastic tube, will be inserted into the veins in your hand, and this will allow us to give you sedation. You will be then brought into the room. What are the risks associated with the procedure? Prior to the procedure being undertaken, the doctor will ask you to read and sign a consent form that will explain the procedure in detail together with the risks. The main risks of colonic stenting include bleeding, perforation, the after effects of sedation, together with pain afterwards. These risks are small and far outweigh the risks of not having the procedure. In the case of bowel obstruction due to a tumour, if one does not have a relieving procedure such as a colonic stent, there is a risk of bowel perforation, which in itself is extremely serious and may be fatal. The procedure and what happens afterwards. You'll be taken into the room, you'll meet the team, we'll give you some sedation into the cannula in your hand. The procedure will be undertaken. On average, the procedure takes approximately 60 minutes. Once the procedure has been safely performed, you'll be taken out into the recovery area to relax for approximately 2 to 3 hours. After you've recovered from the sedation, you'll be given something to eat or drink. Thereafter, once we're happy that you've recovered fully, you'll be allowed home. Over the next 2 or 3 days, the stent gradually opens. There may be a little abdominal pain as this occurs, but your bowel function should gradually return to normal. You may well be given some laxatives to ensure that your bowel function returns to normal. If you have any problems over the next few days after the procedure, please contact the endoscopy unit. If this is out of hours, please contact the A&E department.